There is a bottle sitting in your medicine cabinet right now that your doctor approved, that your pharmacist filled without a second thought, and that you have been taking faithfully for years because you believed it was protecting your bones. Cardiologists privately call it a slow heart attack in a capsule. I am talking about high-dose calcium supplements. And if you are over the age of 60 and you are taking one right now, what I am about to share with you in the next few minutes could be the most important health information you have received in years. Because the same calcium that you believe is going into your bones is, according to a growing body of medical research, ending up somewhere else entirely, somewhere far more dangerous. And the consequences of that misrouted calcium are being felt right now, quietly, inside the arteries that carry blood to your heart and your brain. I know that sounds alarming. I know you have been told for decades that calcium is essential, that more is better, that supplementing is responsible. And in many cases, for many nutrients, that is true. But calcium, after the age of 60, operates by a completely different set of rules inside your body. Rules that most doctors simply do not have time to explain in a routine visit. Rules that the supplement industry has absolutely no incentive to tell you about. By the end of this video, you will understand exactly what happens to supplemental calcium inside the aging body, why it behaves so differently from the calcium in your food, the specific type and dose that research has flagged as most dangerous, and most importantly, what you can safely take instead that actually delivers calcium where your body needs it most. Stay with me through the entire video, because what I reveal about the combination of nutrients your body actually needs, instead of calcium alone, is something that most people, including many physicians, have never been properly taught. My name is Dr. Jeremy. I am a board-certified internist with over 28 years of clinical experience, specializing in cardiovascular risk management and preventive medicine in adults over 60. I have reviewed thousands of cardiac cases in my career, and one of the patterns I kept encountering over and over again was patients with no obvious lifestyle risk factors, who exercised, who watched their diet, who took their supplements religiously, showing up with arterial calcification that their age alone could not explain. When I started asking the right questions, calcium supplementation kept appearing in the picture. Not always, but consistently enough that it changed how I counsel my patients permanently. And today I want to share what I have learned with you, because you deserve to have this conversation outside of a rushed 15-minute appointment. To understand why calcium supplements can be dangerous for the aging heart, you first need to understand something fundamental about how calcium moves in and out of your body. When you are young, your body has a highly efficient system for directing calcium where it belongs, into your bones and teeth, away from your soft tissues, your arteries, and your organs. This system is managed by a team of nutrients working together in precise balance, primarily vitamin D3, vitamin K2, and magnesium. Think of it like a sophisticated highway system. Calcium is the vehicle. Vitamin K2 and magnesium are the traffic controllers, making sure those vehicles reach the right destination and do not pile up in the wrong places. Vitamin D3 is what gets the vehicles onto the highway in the first place. Here is what changes after 60. Your body's ability to produce vitamin K2 decreases with age. Your magnesium absorption becomes less efficient. Your hormonal regulation of calcium, which was previously handled in part by estrogen and testosterone, weakens as those hormones decline. The traffic control system becomes unreliable. Now here is the problem. When you take a high-dose calcium supplement and your traffic controllers are compromised, that flood of calcium entering your bloodstream has nowhere regulated to go. It does not simply sit in your blood harmlessly. It begins to deposit in places it absolutely should not be. The lining of your arteries, the walls of blood vessels, the soft tissues surrounding your heart. This process is called vascular calcification, and it is one of the most significant independent risk factors for heart attack and stroke in adults over 60 that exists. The arteries that are supposed to be flexible, elastic, and able to expand and contract with each heartbeat become rigid, stiff, unable to absorb the pressure wave from your heart. Your blood pressure rises, your heart works harder, and inside those calcified arteries, plaques become more fragile and more prone to rupturing under pressure. And the terrifying part is this: you feel none of it. Vascular calcification produces no pain, no symptoms, no obvious warning until the damage is advanced enough to cause a cardiac event. Now I want to walk you through the science behind this because I do not want you to take my word for it. I want you to understand exactly what the data shows. In 2010, a landmark meta-analysis published in the British Medical Journal reviewed data from 11 randomized controlled trials involving nearly 12,000 participants. The researchers found that calcium supplements taken without vitamin D were associated with a 27 to 31% increased risk of heart attack. Not a marginal finding, not a borderline association, a 27 to 31% increase. That study sent shockwaves through the medical community. But the supplement industry was largely quiet about it, and most physicians did not have the bandwidth to update their patient counseling because of it. A follow-up study published in Heart, a prestigious cardiovascular journal, tracked more than 23,000 adults over a decade and found that those who took calcium supplements regularly had significantly higher rates of heart attack compared to those who got their calcium entirely from food. Here is the key distinction that most people miss. Calcium from food sources, dairy, leafy greens, legumes, does not appear to carry the same risk. Because dietary calcium enters your system gradually, in modest amounts over time, allowing your body's regulatory system to manage it properly. Supplemental calcium, particularly in high doses of 1,000 milligrams or more, floods your bloodstream all at once in a way that your body was never designed to handle. Are you finding this information helpful? If you are watching right now and you are currently taking a calcium supplement, I want you to write the word calcium in the comments below. It tells me this message is reaching the people who need it most, and it may remind someone else who reads your comment to watch this video before their next dose. Let me tell you about Gloria. She was 72 years old when she first came to my practice. A retired school teacher from Ohio, meticulous about her health, walked every morning, kept a detailed food journal, took her supplements every day without fail. She was proud of her discipline. She had every reason to be. She had been taking 1,200 milligrams of calcium carbonate daily for 14 years, ever since her gynecologist had recommended it at menopause. It had never been revisited. It had never been questioned. It was simply part of her routine. When she came to me complaining of occasional chest tightness and fatigue, I ordered a coronary artery calcium scan, a simple imaging test that measures the amount of calcium buildup in the arteries of the heart. Her score was deeply concerning for her age and her otherwise clean lifestyle. Her diet was not the culprit. Her exercise habits were excellent. But 14 years of unmonitored high-dose calcium flooding her system with insufficient cofactors to direct it had left deposits in arteries that should have been clear. We stopped the calcium carbonate immediately. We introduced a properly balanced protocol that I will explain later in this video. 18 months later, her follow-up scan showed her progression had halted. She told me, "Doctor, I thought I was doing everything right. That is what makes this so dangerous. It does not look or feel like a mistake. It looks like responsibility." Not all calcium supplements carry equal risk. And I want to be precise with you here because the details matter. Calcium carbonate, the most common and most problematic. This is the form found in the most widely purchased over-the-counter calcium supplements and in antacids like Tums that many seniors use daily for heartburn. Calcium carbonate requires stomach acid to be absorbed, and after 60, stomach acid production naturally decreases. This means less calcium is absorbed into the bones and more accumulates elsewhere. It is also the form that delivers the largest single-dose calcium spike into the bloodstream. Calcium citrate, somewhat better, still requires caution. This form is better absorbed in low-acid environments and is gentler on the digestive system. It carries somewhat lower risk than carbonate, but is not risk-free in high doses. Many physicians recommend it over carbonate for seniors, and that is reasonable, but dose still matters enormously. The dose threshold. Research consistently flags doses above 500 milligrams per day as the zone where cardiovascular risk begins to rise significantly. Yet most standard calcium supplements are sold in 500 to 1,200 milligram doses. Many people take 2 doses per day without realizing the cumulative total. If you are currently taking a calcium supplement and you do not know the dose, I want you to go get the bottle right now and look at the label. The serving size matters. What you actually take per day matters. Write that number in the comments along with your age. Because the first step to protecting yourself is knowing what is actually going into your body. Arthur was 68 years old, a retired postal worker from Georgia. Big man, strong handshake, the kind of person who had never been sick a day in his life and was proud of it. He came to me after a cardiac stress test had flagged something his previous doctor had described as mildly abnormal. Arthur did not smoke. He walked 4 miles a day. His cholesterol numbers were managed well with a low-dose medication. By most conventional measures, he was not a high-risk cardiac patient. But Arthur also took 3 supplements every single morning. A multivitamin with calcium, a standalone calcium supplement his wife had suggested, and a daily antacid for occasional indigestion. His total supplemental calcium intake was averaging 1,800 milligrams per day, every single day, for 6 years. When I reviewed the full picture, that calcium burden was the thread connecting everything. We worked with his cardiologist to restructure his entire supplement protocol. Arthur told me the hardest part was telling his wife he was stopping the calcium she had recommended. But 6 months later, he came back to my office and said, "I feel lighter. I do not know how else to describe it. My chest does not feel tight in the morning anymore." His follow-up imaging was meaningfully better. Arthur asked me to share his story. He said, "If I had known what I was actually doing to my heart, I would have made different choices years ago. That is why we are having this conversation today. Now let me give you what you actually came here for. Not just the warning, but the solution. Because the goal is not to tell you calcium does not matter. It does. Strong bones matter. Muscle function matters. Nerve signaling requires calcium. The goal is to get calcium into your body in a way that your body can actually use properly. Step 1. Prioritize dietary calcium over supplements. Your body handles food-derived calcium fundamentally differently from supplement-derived calcium. The dose is smaller, the absorption is regulated, and the accompanying food matrix slows the entry into your bloodstream. Aim to get as much of your daily calcium need as possible from food. The best dietary calcium sources for adults over 60 are plain low-fat yogurt, canned sardines and salmon with bones, kale and bok choy, cooked white beans, and fortified plant milks if you are dairy-free. These sources deliver meaningful calcium in amounts your system can manage without flooding your arteries. Step 2. If you supplement, use calcium citrate at low dose. If your physician has determined that your dietary intake alone is insufficient, which is a conversation you need to have with your specific doctor and your specific bone density results, then calcium citrate in doses no higher than 500 milligrams per day is the safest supplemental form. And that 500 milligrams counts everything, including what is in your multivitamin. Read all of your labels. Step 3. Add vitamin K2 and magnesium. This is the most critical piece that is almost never discussed. Vitamin K2, specifically the MK7 form, is the nutrient that activates the proteins that direct calcium into bone and actively prevents its deposition in artery walls. Research published in the journal Thrombosis and Hemostasis found that adequate vitamin K2 intake was associated with significantly reduced arterial calcification and improved cardiovascular outcomes in older adults. A daily dose of 90 to 120 micrograms of vitamin K2 MK7 is what most research supports. Important note: if you are on blood thinners like warfarin, you must discuss vitamin K with your doctor before adding it, as it interacts with that class of medication. Magnesium is the second missing piece. Magnesium works alongside vitamin K2 to regulate where calcium is deposited in the body. Studies suggest that more than 50% of adults over 65 are magnesium deficient. Magnesium glycinate or magnesium malate are the most absorbable forms and are gentler on the digestive system than magnesium oxide, which is the least absorbable form and unfortunately the most commonly sold. A daily dose of 200 to 400 milligrams of magnesium glycinate taken with food supports calcium regulation, reduces vascular stiffness, supports deep sleep, and helps control blood pressure. Your heart uses magnesium with every single beat. Step 4. Ask your doctor for a coronary artery calcium scan. This imaging test, sometimes called a CAC scan or a cardiac calcium scoring test, takes about 10 minutes and requires no contrast dye. It measures the amount of calcified plaque in your coronary arteries and gives you and your doctor a precise, objective picture of where things stand. Many insurance plans cover it for adults over 60 with cardiac risk factors. Even if you pay out of pocket, it often costs between $75 and $150 at imaging centers. It is one of the most valuable tests available for assessing real-world cardiovascular risk, and it is vastly underused. If you have been taking high-dose calcium supplements for years, this test gives you a baseline. Knowledge is protection. Here is what I want you to do starting today. Not next week, not after your next appointment. Today. Action 1. Go to your medicine cabinet right now. Collect every supplement you take. Every single one. Find the calcium content on each label. Add them up. If your total daily supplemental calcium exceeds 500 milligrams, that is your first conversation to have with your doctor. Action 2. Stop taking calcium carbonate. If your supplement is calcium carbonate and your doctor has not specifically told you that this form is necessary for your situation, switch to calcium citrate if you need to supplement at all. Better yet, focus on food sources first. Action 3. Add vitamin K2 MK7 to your routine. Look for a supplement that contains at least 90 micrograms of vitamin K2 in the MK7 form. Many vitamin D3 supplements now come combined with K2. This combination makes far more biological sense than D3 alone and reflects how these nutrients actually work together in the body. Action 4. Ask your doctor about a magnesium level test. Standard blood panels measure serum magnesium, but this number can look normal even when cellular magnesium is depleted. Ask specifically for an RBC magnesium test, which measures magnesium inside red blood cells and gives a more accurate picture of your true status. Action 5. Request a CAC scan conversation. At your next appointment, ask your doctor whether a coronary artery calcium score is appropriate for you, given your supplementation history and your cardiovascular risk profile. Come prepared. Bring your supplement list. Ask the specific question. Your doctor will take you more seriously as an advocate for your own health when you arrive informed. I want to leave you with something before you go. Because I know this video may have created some anxiety, you have been doing something you thought was right. Something a doctor recommended, possibly many years ago. And now you are wondering how much damage has already been done. Here is what I want you to hear. The body has an extraordinary capacity to stabilize when we stop adding to the problem. Arterial calcification, once it is present, does not simply dissolve, but its progression can slow, sometimes dramatically, when the conditions that drove it are corrected. Gloria's scan showed halted progression. Arthur's imaging improved meaningfully. The body responds to the right inputs at any age. You are not too late. But you do need to know the truth before you can act on it. Share this video tonight with someone you love. Your spouse, your sibling, your closest friend who takes their calcium religiously every morning because they were told to. You may never fully know whose life you just changed by passing this along. And if you have not subscribed to this channel yet, please do that now. Every single week, I release content built specifically around the hidden health risks, overlooked research, and practical tools that adults over 60 need to make genuinely informed decisions about their own bodies. Hit subscribe and the bell notification so you never miss a video. Drop your age and the supplement you are going to re-examine in the comments below. I read every single one, and I want to know that this information is reaching the people who can actually use it. Your heart has been working for you every minute of every day for 6, 7, 8 decades. It deserves the right support. Not just any supplement that sounds responsible on a label. Give it the right team. K2, magnesium, real food calcium, and the knowledge to know the difference. I am Dr. Jeremy, and I will see you in the next